Hi, happy morning, everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your upcoming nursing competitive exams. So in our channel, we are posting important topics and as well as important MCQs for the nursing competitive exams. So kindly subscribe our channel so that we will upload the more and more questions that will be helpful for your upcoming exams. Okay, we'll start today's session with a small quote. If you can dream it, you can do it. உங்களால் கனவுகள் காண முடியும் என்றால் அதை நிஜமாகவே நடத்தவும் முடியும். Okay. Okay. We'll start today's session with the questions related to multiple sclerosis. Okay. Everybody knows that multiple sclerosis, there is an damage and demyelination in the myelin sheath that leads to the conductions problem in the all over the body. Okay. Okay, first question. The nurse is assessing a 48-year-old client diagnosed with multiple sclerosis. Which clinical manifestation warrants immediate interventions? The client has scanning speech and diplopia. The client has dysarthrians, scotomas. The client has muscle weakness and spasticity. The client has a congested cough and dysphagia. So all the symptoms are related to multiple sclerosis only, but which manifestation required immediate intervention? That means which symptom is more serious? So the correct answer is option 4. Dysphagia is a common problem of client diagnosed with multiple sclerosis, but at the same time that the patient is having a congested cough. So if the patient unable to swallow the cough, what will happen? There is a chance of aspiration that can lead to pneumonia and infections. Okay. Remaining symptoms like scanning speech, diplopia, dysarthria, scotomas, muscle weakness, everything is expected manifestation of the multiple sclerosis. But the question is, which manifestation requires immediate intervention? So that cough and dysphagia. Okay. Yes. So we have to place the patient in a semi-Fowler's position. Okay. So important measurements which prevents the aspiration, that has to be seen immediately. Okay. Next question. The client diagnosed with an acute exacerbation of the multiple sclerosis placed on high dose intravenous injection of corticosteroid medications. Which nursing intervention should be implemented? Discuss the discontinue the proton pump inhibitor with the healthcare provider. Hold the medication until after all the cultures have been obtained. Monitor the client's serum blood glucose level frequently. Provide supplemental dietary sodium with the client's meals. So everybody knows it's very easy. The question look like big, but the answer is very easy. So whenever the patient who is taking steroid, not only multiple sclerosis, any patient who is on the long-term or acute particular time of taking a steroid, we have to check the glucose level, blood glucose level. There is a chance of hyperglycemia because the steroid will stimulate the glucose metabolism. Clear? And option 1, discussing discontinue the proton pump inhibitor, it's wrong answer because we need to continue the proton pump inhibitor like Panto, because there is a chance of, because of steroid, there is increased acidity. So to prevent that, proton pump inhibitor is required. Do not discontinue it. And hold the medication until after all the cultures have been obtained. Option 2. That is also wrong. It is not related to the high dose of corticosteroid. It is related to our antibiotic, right? So we have to wait for the culture report for the antibiotic. So that is option 2. That is also wrong. Option 4, provide supplemental dietary sodium with the client's meal. No. When the patient is taking steroid, already the sodium level will be in the higher level. So we have to give the sodium restricted diet. Okay. Yes. So the correct option is answer 3. Sorry, option number 3. We have to monitor the blood glucose frequently. Which are the following are symptoms of MS? That is multiple sclerosis. So we have to select multiple options. Okay. It's a kind of an NCLEX question. Okay. Weakness, loss of sight, loss of bowel control, internal bleeding, poor coordination, paralysis, loss of balance, cancer. So what is the correct options? Okay. The options are weakness will be there, loss of bowel control, poor coordination, paralysis, loss of balance will be there. Okay, loss of balance will be there. There is no loss of sight. Maybe the patient, the visual acuity, the visual pathway may be affected, but there is no loss, complete loss of sight. Okay, that is wrong. There is no internal bleeding. Option D also wrong. And option H, cancer. It is not a cancer, right? Yes. So remaining options are correct about the multiple sclerosis. Next question. You are performing patient to move the head and neck downward. The patient reports electric shock sensation that travels down to the body. You would report your finding to the doctor that the patient is experiencing what sign? So the options, Romberg sign, Lemaitre sign, Uthoff sign, Homan signs. So what is the correct option? Yes, it is Lemaitre sign. If you tell the multiple sclerosis patient to bend the neck, the shocking sensation, patient will have the electric shock-like sensation will travel from the neck to the lower part of the body. That is Lemaitre sign. What is Romberg sign? Everybody knows. That is when you assess the vestibulocochlear nerve, you ask the patient to close the eyes and keep the foot very close. The patient will have the imbalance if they have any problem with the vestibulocochlear nerve, right? That is Romberg's sign. What is Uthoff sign? That is also related to the multiple sclerosis. When the patient is exposing their body to higher heat, that time the patient will feel down. Okay, that time the patient will feel down. For example, the patient is exposed to the hot and humid weather, direct sunlight, using hair dryer, doing so much of exercise, taking hot baths, and the infections, any hormonal fluctuation, that time the potential trigger of Uthoff's phenomena will occur when the patient is having a multiple sclerosis. So that's why the multiple sclerosis patient, they will avoid the hot climate. They always like the cold climate. Okay. Yes. So everybody knows what is Homan signs. When you dorsiflex the foot, the patient will have the cough pain when the patient is having the DVT. Right? Yes. So here, according to question number 4, the correct option is B, Lemaitre sign. Next, a patient with multiple sclerosis has issues with completely emptying the bladder. The physician orders the patient to take dash, which will help with the bladder emptying. Tell me. Yes. What are the options? Bethanycol, oxybutynin, Avonex, amantadine. So the correct option is option A, Bethanycol. So Bethanycol is for what? To empty the bladder completely. It will help to empty the bladder completely. Okay. So what about oxybutynin? That is for the overreacting bladder. Overreacting bladder. Incontinence is happening. That patient will be given with the oxybutynin. What is Avonex? Avonex is a drug of treatment for the multiple sclerosis. It is nothing but it contains interferon. Okay, that is Avonex. What is amantadine? That everybody knows. That is used in the Parkinsonism. Right? Okay. That's all about today's session. Thank you so much. I hope the class was helpful. If you like the class, please press like button and please comment how was the class. Thank you all. Please subscribe our Metier YouTube channel so that we will update more questions. So see you all. See you in the next class. Thank you so much.